This is Dr. Hall, a gastroenterologist at Memorial Hospital. He has many colonoscopies to complete during his inpatient rotation. Two of today's cases are of particular concern: a patient in the ICU with a post-polypectomy GI bleed, and an elderly inpatient who has not been able to tolerate the bowel prep solution but needs a colonoscopy due to a possible gastrointestinal tumor. Dr. Hall's biggest concern with these patients' conditions used to be having adequate visualization to diagnose and treat. However, 2 months ago, Dr. Hall started using the new PureView system, and since then, he's much more confident in having the necessary visualization needed to proceed with these challenging colonoscopies as scheduled. Introducing the new PureView system. It improves visualization for a high-quality colonoscopy the first time. In fact, in a recent study, doctors achieved a successful colonoscopy for intended indication upon first attempt in 98% of patients. PureView is a single-use oversleeve that easily fits on most standard or slim colonoscopes. This technology utilizes two key features to facilitate intraprocedural cleansing of the colon. It is the only system with 4 pressure-controlled irrigation jets using a pulsed vortex of air and water to break up debris, and has more than 2 times the suction volume than a traditional colonoscope to rapidly remove fecal material. All features are easily operated by the touch of a foot pedal. In addition, the 2 separate suction channels have an auto-purge function to avoid clogging and mucosal tissue suctioning. Dr. Hall likes PureView because it cleanses the colon content away quickly, allowing him to get good visualization to complete a successful exam on these challenging patients when preparation can be an issue. In another recent study, regardless of patient pre-procedural bowel prep, adequate preparation improved from 38% to 96% following use of the PureView system. Dr. Hall starts with the GI bleed patient, a 55-year-old named Alan who recently had a cecal polyp removed, and now he's presented with multiple episodes of abdominal cramping and bright red blood from the rectum. Alan was quickly admitted to the ICU, and Dr. Hall was called to assess the patient and address the bleeding. Due to the urgency of the situation, a full prep was not possible. Only an enema was used to remove solid stool near the rectum. Dr. Hall was comfortable moving forward with Alan's procedure, having the PureView system to clear out the remaining debris. He was able to clear the blood, to properly visualize the polypectomy site, and effectively place a clip to achieve hemostasis. Alan was transferred out of ICU less than 4 hours later and discharged the next morning. As for the elderly patient, Beth is a 75-year-old woman in a wheelchair with limited mobility. Her latest CT shows a suspicious mass on her colon, so she's being sent to Dr. Hall for a diagnostic colonoscopy. Due to her age and comorbidities, Beth was unable to tolerate the prep regimen. Having now been in the hospital for almost 24 hours, Dr. Hall is concerned with further malnutrition and infection risks associated with being NPO and having to stay another day in the hospital. Now that he has PureView, he is not dependent on the quality of the pre-procedure preparation, as he can effectively clean out significant debris during the procedure. After just a short time cleansing with the PureView system, Dr. Hall was able to get a great view of the mass in the cecum, which facilitated a definitive diagnosis. Dr. Hall is very pleased with his success rate using the PureView system. He knows he is providing high quality of care for all of his patients. To find out more about PureView, visit our website at www.motusgi.com.